What you're about to hear gets progressively worse. By the end, you'll understand why governments don't want people knowing this stuff exists. Operation Northwoods. In 1962, the entire U.S. military leadership wrote a plan to attack America. Not an enemy, America. The plan was to blow up American ships, shoot down American planes, set off bombs in American cities, then blame it all on Cuba. The goal was to make the public angry enough to support a war. This wasn't some crazy idea from a rogue general. The Joint Chiefs of Staff wrote it, all of them, then signed it, then sent it to the Secretary of Defense. Some versions said the casualties needed to be real. Fake deaths wouldn't be convincing enough. Kennedy said no. A few months later, he was assassinated. Whether those two things are connected, nobody knows. The document stayed classified for 35 years, released in 1997. The plan was real, it was official, and the only reason it didn't happen is because one person said no. Project Artichoke. The CIA had one question. Can you completely destroy a person's free will? Not kill them, not hurt them until they talk. Actually break their mind, so completely that they'll do whatever you tell them, even things they would never agree to on their own. Project Artichoke started in 1951. They used drugs, hypnosis, sleep deprivation, isolation, on real people. Some were prisoners, some were mental patients, some had no idea they were part of anything at all. The goal was to build a person with no will of their own, someone the CIA could point at a target and use. In 1973, right before Congress started investigating, the CIA destroyed most of the files. What survived was found by accident, a storage room nobody remembered to include in the destruction order. What came after Artichoke was called MK Ultra. Same idea, way bigger. Hundreds of Americans were dosed with LSD without knowing it. In bars, at parties, on the street. One CIA scientist named Frank Olson was dosed without warning. 9 days later, he went through a 10th floor window in New York. The CIA called it suicide. His family had his body dug up in 1994. There was blunt force trauma to the skull. It happened before the fall. Congress investigated in 1977. Most witnesses said they couldn't remember. Most of the files were already gone. Project Iceworm. In the late 1950s, the U.S. Army asked Denmark for permission to build a science research station in Greenland. Denmark said yes. That was a lie. The real plan was called Project Iceworm. The U.S. wanted to dig hundreds of miles of tunnels under the Greenland ice, then fill them with up to 600 nuclear missiles, all pointed at the Soviet Union. The ice would hide everything. Nobody would ever know they were there. They built Camp Century first. Officially, it was a research prototype. It had a hospital, a cinema, a church, a nuclear reactor. Around 200 soldiers lived there. Denmark had no idea any of this was happening on their own land. The project got cancelled, not because it was wrong, because the ice kept moving. The tunnels kept collapsing. They couldn't keep the missiles aimed at anything. When Denmark eventually found out what had been built on their territory without permission, it became one of the biggest diplomatic scandals in their history. The base is still there under the ice. The reactor was removed, but all the waste was left behind. Chemical, radioactive, biological. As the ice melts, it's all coming back up. Scientists say it'll reach the surface within decades. Operation Sea Spray. In September 1950, the U.S. Navy sailed along the coast of San Francisco for 6 days. The whole time they were spraying bacteria into the air over the city. 800,000 people were exposed. Nobody was told. The military wanted to see how a biological attack would spread through a real city. They picked bacteria they believed were harmless. A few weeks later, a rare bacterial infection swept through a San Francisco hospital. 11 people got sick. 1 died. His family sued the government. They lost. The court said national security came first. That was one test. The military ran over 200 open-air biological tests on American cities between 1949 and 1969. They released bacteria into the New York subway. They sprayed chemicals near the Pentagon. All of it stayed classified until 1977. Most Americans still don't know it happened. Project Sunshine. After years of nuclear testing, the U.S. government wanted to know how much radiation had gotten into people's bodies. The best way to measure it was in human bones. They needed fresh bones from people who had lived through the testing years, so they took them, without asking. Government agents worked with hospitals and morgues across the US, UK, Australia, and Brazil. When babies and small children died, samples were taken before the body went back to the family. Parents weren't told. In most cases, they didn't even know an autopsy had taken place. At least 1,500 bodies, most of them children, The results confirmed what they feared. Radiation levels in human bones were rising every year. One internal memo explained why they kept it secret. It said it would be a public relations disaster. The UK didn't officially admit the program existed until 2001. Willowbrook State School Willowbrook was a state institution for kids with intellectual disabilities in New York. Built for 4,000 kids, housing over 6,000 by the 1950s, the conditions were bad, really bad. Kids living in their own waste, disease everywhere, staff completely overwhelmed. A group of researchers from New York University looked at that situation and saw an opportunity. Hepatitis was spreading through Willowbrook constantly, so they decided to study it. The way they studied it was by deliberately infecting newly admitted children with the virus. They fed them extracts made from the waste of already infected kids, sometimes in food, sometimes in chocolate milk. Parents who wanted their child admitted were told the only open spots were in the research unit. Sign the form, or your kid doesn't get in. The experiments ran for 14 years, published in respected medical journals. Some researchers publicly defended them. They argued the kids would have gotten hepatitis anyway given the conditions. The research did eventually help develop the hepatitis B vaccine. Whether that makes any of it okay is something people are still arguing about. Tuskegee. In 1932, the U.S. Public Health Service started a study in Alabama. They recruited 399 black men who had syphilis. The men were told they were being treated for bad blood, a general term doctors used at the time. They were not told they had syphilis. They were not told what the study was actually measuring. The study was supposed to last 6 months. It lasted 40 years. In 1947, penicillin became the standard cure for syphilis. The men didn't get it. Researchers called local doctors. They called draft boards. They made sure these men couldn't access treatment anywhere, not a single place. The whole point was to watch what untreated syphilis does to a human body over a lifetime. A cure would end the study. By the time a whistleblower leaked the story to the press in 1972, 28 men had died directly from syphilis. 100 more had died from related complications. 40 wives had been infected. 19 children were born with it. The government paid $10 million in settlements. Nobody went to prison. Nobody was charged with anything. The last survivor died in 2004. Unit 731. This is the last one, and it's not close to anything else on this list. Between 1937 and 1945, the Japanese military ran a facility in occupied China. Officially, it was a water purification unit. What actually happened inside doesn't fit into normal language. Prisoners were used as live test subjects. Chinese civilians, Soviet soldiers, Korean and Mongolian captives. Researchers tested how long a human body survives frostbite. They put people's limbs into frozen water and left them there. They infected prisoners with plague, with cholera, with anthrax, by injection, or by releasing it into a sealed room with people locked inside. They performed surgery on living, conscious people. No anesthesia. They said it would affect the data. They tested flamethrowers on people. They detonated biological bombs near prisoners tied to stakes in open fields. They ran pressure experiments to find the exact point at which the human body ruptures. Estimates of total deaths range from 3,000 to over 10,000. When the war ended, the commander of Unit 731 made a deal with the United States. Full immunity from war crimes prosecution. In exchange for all the research data, the U.S. accepted. Every scientist and officer who cooperated walked free. None were tried at Tokyo. Many went back to normal careers in Japanese medicine and business. The deal stayed classified until the 1990s. Japan didn't officially acknowledge Unit 731 existed until 1997. A full apology has never been given. If you made it to the end, subscribe, and drop a suggestion for the next video in the comments.